Good evening, everyone. It's great to be back here with you after the weekend. It is time to start our first webinar tonight because if you don't know yet, we do have two webinars tonight. So we are starting at 6 p.m. UK time, of course, with the topic on elective single embryo transfer. And as you can see, we do have another special guest and IVF nurse this time with us. Hello, Patricia. How are you feeling?
Hello.
Hope you hear me well.
Good, thank you. Hello.
Perfect. Thank you so much for joining us tonight. As I've mentioned, you are a nurse, but I didn't mention that you are right now in Portugal, Coimbra. So welcome. And I know that you already had some webinars with Dr. Vladimiro. So this is your team member, of course. And so just so you know, Patricia, she is a part of nursing staff at Ferticentro. So it's great to have another team member from Ferticentro for sure. And thank you for agreeing to preparing this presentation for us. This is going to be for sure interesting. And as you know, we will start with the presentation, but afterwards, as always, it will be time for your questions. So don't forget to type those in the chat section. You can do it during the presentation or afterwards so that Patricia can help you out with your answers as well. And as you know, my IVF Nurses, we are a part of European Fertility Society, and we are here to support you, to provide you with some top fertility experts, psychologists, nurses, and anyone that can really bring something to you and also to bring something to our IVF community anywhere in the world, really. So I'm very proud to be a part of it as well. And thank you, everyone, for joining us over and over again. This is incredible to see, being here every day, that you ask questions, you still come in, and it's definitely amazing to see that every day. And that will be it from me at this point. I guess it is time to start with our topic tonight. Patricia, ready to go?
Yes. Yeah.
Let's go ahead with it then.
Okay. Hello, everyone, and thank you for joining this webinar today. So I'm gonna speak a little bit about decisions of doing an elective single embryo transfer, the pros and cons, and the most recommendations for various patient groups. So I'll start with this chart. Is a study from a European society where it shows that the difference of the results when transferring 1, 2, or more embryos. So what we can see in this chart, I'm just going to put this pointer here. So when transferring one embryo, so as you can see, the rate of having one child, so one baby, is 90%, and that, of course, when transferring two, the chances of having twins almost goes from 2 to 41. That has 20 plus times that when transferring one. And sorry. So what we must see here is that when transferring 3 or 4 embryos, the chances of having twins doesn't increase. So it's pretty much the same. So the point that's important here is that probably that's not too much of advantage of transferring 3 or 4 embryos, because the rates of having twins, it's pretty much the same. So go ahead. Then, when transferring 2 or more, has increased the rate of births of twins. This has an impact in the society. The first IVF was in 1978, so the majority of the IVF treatments were made were starting to be made in late 90s. What we can see in this chart is that if the rate of having twin pregnancies would have been naturally, this would be always around 80,000 annual twin pregnancy. So the blue bars. But because of the IVF treatments, nowadays it's higher than 120,000 a year. So of course, there's always a romantic version of having twins, because couples think that you have an instant family straight away, so you don't need to think of having a second pregnancy. And having twins, it's very cute, and dressing them like the same, having this kind of thought that they are connected mentally, of course. But this also has some impact in the society, financial in the families, and I'll speak about this later. Okay, but just to let you know, that this has a huge impact in the society nowadays. As we could see in the first chart, the number of twins is directly related to the number of transferred embryos. And in the past years, we have seen some changes, and this is on the decision of transferring 1, 2, or more embryos. So as you can see in this chart, this is a study that shows that was made by the European Society of Human Reproduction with data from 2013, with that related with the embryo transfers from 1997 to 2013. And this shows that at the beginning there were still some transfers with 4 embryos, but then this was very quickly decreased, because there was no shown evidence that there was some kind of profit of or any good results better than transferring 2 or 3. Then we see that with the red line, we see that at the start, transferring 3 embryos, the rate was even higher than transferring 2. But then also there was a change here where it shows that the tests and the positive pregnancies and the rates of even twins were not any higher than when transferring 2. Then in the blue line, we can see that there's more and more couples that decide transferring only 1 because of a lot of reasons. Some of them I will speak about them later. And what it's a good sign is that even that the number of embryo transfers when transferring 2 has increased. In this, we see this very eccentric curve, but now is stabilizing. So this is a good sign. We could see this some decrease here, but for now it's good to know that at least it's not going higher. So what are the complications and cons on having a multiple pregnancy? So this table has a lot of information, but what is important here is that there are problems, health problems for the mother, the child, and also psychological effects on the family and financial problems on the family and on the society. So just to mention a few maternal problems, we have impacts in problems like preeclampsia, diabetes, some cases of placental previa, abruption, preterm premature rupture of membranes, sometimes death, postpartum hemorrhage. And for the health of the child, there's a lot of health problems that can happen when babies, when between pregnancy. Some are more common than others. So we can see here like premature aging, twin transfusion syndrome, spontaneous abortion, intrauterine growth restriction, preterm, very preterm, and extreme preterm birth. That's when babies are born under 28 weeks. Perinatal and infant mortality, low and very low birth weight, sepsis, development delays, cerebral paralysis. Well, there's a lot of problems that can happen when having multiple pregnancy. And then some society issues, sometimes postpartum depression to the mother or to the couple, relationship stress because the couple is not ready to have to deal with two babies at the same time, and it's very challenging, it's very demanding to deal with one baby born, imagine with two, and even if there is some health conditions that is even more stressful for the couple or for the mother, and also financial stress, not only for the couple itself, but also for the society, for the hospital, because there's always costs for caring for multiple children, neonatal intensive care admission. So this is a lot of problems and impacts that are very directly related to having multiple pregnancy. So, of course, we know stories that went well, so pregnancies of twins that ended up well and they're very happy. And fortunately, most of the stories that we heard are happy stories. But don't forget that when the rates of multiple pregnancies are higher, all these risks are very, very present. So, despite all these aspects, why do couples insist in transferring more than one embryo? Well, because they're suffering and they're going through an IVF parkour for a long time, and they just want to have a baby as soon as possible. And we're here to help them. So seeing this chart, the first chart again, it's true that the rates of pregnancy when transferring two is more than when transferring one, but this is not that much higher. So as you can see here, the rates of pregnancy when transferring one is 50%, and the rates of having of a pregnancy, twin or singleton, when transferring two is 57%. So what we need to think here is, does this difference, does it compensate the risk when we have all those problems that we saw before of having twins? Because if we see that, if we tell you that the rates of having that the pregnancy will go ahead, it's pretty much the same. Would you decide of having a twin pregnancy knowing that you could have all those, or not, I mean, not all, but you could have the risk of health problems for you and for your baby if the pregnancy was a twin pregnancy? So this is the question that is important to take in mind. So what we need to think also is there another way to maximize the odds of pregnancy while avoiding the risks of multiple birth? And yes, there is, and we'll speak about them straight away. So one of the approach is the PGT. I don't know if you heard about it. So this is the genetic pre-inflammatory testing. So when possible, this pre-implantation genetic test is a technique used when the embryo reaches the blastocyst stage, and then we analyze the blastocyst to see if there is any genetic disease. And if we can see in this chart, this study was published by one of the worldwide leaders doing this genetic testing. That's called Genomics, and they have labs all around the world. So as you can see, when transferring in the blue bars, when transferring one tested embryo, the rates of implantation, they are pretty much the same. So they're all over 40%, no matter the age of the woman. But if transferring embryos without testing through the age of the woman, the rates of implantation decrease very considerably. So this genetic implantation is something that we highly recommend. And when having the baby, I'm sorry. So if transferring embryos randomly, so without testing, the rates will drastically reduce, as it's shown here in the orange bars, over the age of the woman. So this is a point that is very important to tell you. Doing a PGT test doesn't improve the quality of the embryo, but it shows us that that embryo is very high quality to be transferred. This is very important to keep in mind. So there's no medical test to tell us that, there's no medical test to improve the quality of an embryo. There's only medical tests to show the quality itself, the quality at the moment, and to tell if there is a genetic disease that will probably not even pursue with the pregnancy, because some genetic disease are not compatible with life. Some of them are, but at this stage, we want to make sure that we are transferring good quality embryos. So the PGT is a very important tool to use, of course, when possible, when legally possible, because in some countries there are very restrictive conditions to use it and to go ahead with it. And also, this is a very important tool to prevent multiple pregnancies. So in this chart, we can see that when transferring one single euploid blastocyst, so the euploid means that was tested and is normal, so no genetic disease. So when transferring one embryo genetic normal, so an embryo that was tested, the rates of live birth are 69%. And when transferring two embryos that were not tested, the rates of live birth were 72%. So as you can see, the difference of pregnancy and of live birth is not that much. And this chart, as you can see here in the blue bar, when transferring one embryo tested, the rates of so when transferring one single embryo, the rates of twins were 0, because one tested embryo usually don't give, we have all the information that it's not going to divide itself, so it's going to be one single baby. And when transferring two untested blastocysts, so the rates of having twins goes to 48%. So as you can see, when testing the embryos, we are sure that we are going to have a single pregnancy, so no twins. And this shows us that also it's going to be a healthy baby. Of course, there are things that we can never assure, but we can see that it's genetically normal. It's going to be a single baby. So this pre-implantation test, it's very, very useful, and when possible, we highly recommend to be done. So another important clinical aspect to have in mind is the female age. When by multiple factors the VGTA is not possible, we can base a decision on transferring one or two embryos on the female age. That has a huge impact also on the rates of the genetically normal embryos. So this study of the American Society for Reproduction advises to make this decision based on the quality of the embryos and on the female age. So this means that, for example, always when having tested embryos, the decision, no matter the age of the woman, is always transferring one embryo. So as you can see, euploid, so we can see that this euploid means that are tested embryos. So when transferring one euploid embryos, the decision is always to transfer one. Then, when our other factors related to the female age, we can see that this can change when the woman is getting older and older. So when we have very good quality embryos, at least until 37 years old, the decision is always to transfer one embryo and avoid as much as possible multiple pregnancies. So this study showed that the recommendation is more favorable on transferring one and maintaining the chance of success and reducing the risk of multiple pregnancy and all that comes with it. We know that when having when having 41 or more years, the chance of having a healthy embryo is lower. So, and this is a very delicate decision to make. And that's why here there are the recommendations of transferring three or four. Of course, this also has a decision is also important based on the legislation of each country. So these numbers here are like this because at this age, 41, over 40 years old, when we don't have the PGT done, so we need to take in consideration that the rates of having genetically abnormal embryos are higher. So that's why there's more advice to transfer more than two embryos. But this is the decision to take very carefully and also always with the medical advice. Another approach is to frozen the exceeded embryos. And probably you've heard somewhere that frozen embryos in transferring them afterwards is not the same as transferring as fresh. So this is not true. This study confirms that the rates of survival after cryopreservation is 99.5%. So, of course, using these Kitazato products that are the top products and ways of the freezing embryos in the world. Of course, these products are also what we use at Ferticentro, just to mention. This means that when it happens that an embryo doesn't survive after the defrozing process, that loss is more highly related with the quality of the embryo and not to the way of the technique to defroze it. So when using these products, the quality and chance of implantation after the defrosting process is equal and high as when transferring as fresh. So it's important to mention that about 10 years ago, when using another techniques, also known as slow pulling, the rates of survival were about 60%. That is much lower than it is today with using this technique of Kitazato. And in these situations, of course, the recommendation would be transferring 2 or more. And these decisions were justified because, of course, no one wants to lose their embryos that were difficult and hard to get, to then lose them on the defrozing process. But nowadays, this is not accurate anymore. So using the appropriate vitrification techniques with high rates of survival, transferring 1 is more than legit. When even allow us to improve the quality of the endometrium in the uterus to receive the embryo. Even at Ferticentro, sometimes we use the freeze-all option because when doing the extenuation, some women don't have the best conditions to transfer on that cycle because the uterus is not good enough. So we freeze all the embryos and transfer on the next cycle when doing a proper preparation. So, but what do patients want? This is the good question. And of course, everyone wants a baby, a healthy baby. What we can see here, this study shows the preference of the patients when transferring 1 or 2. And if they know that the chance of transferring, if they know that the chances of getting pregnant would be pretty much the same when transferring 1 or 2 embryos. So just to make clear, this is not a study. This is not a real study that happened. This is just a theoretical question that was made to couples, okay? So this means that when having the knowledge that the rates of getting pregnant with transferring 1 or 2 embryos would be the same, even though more than 50% of the patients would decide to transfer 2. So even with all the knowledge that they have, they would decide to transfer 2 because they want to have a baby as soon as possible. When knowing that the rates of getting pregnant would be 1% less if transferring 1, of course, here the decision would be even higher, almost 70%. And of course, with 3 and 5%, the chance less, the difference is even higher. So, but this is just a theoretical situation. This didn't happen. It was a theoretical question made to the patients. This is to explain that when doing the genetic testing and adapting the number of embryos to the female age, and using good techniques of freezing embryos, when explaining all these questions to the couples, we must tell them that the rates of having a baby when transferring only 1 is as good as transferring 2. So to them to make a decision with good knowledge, and to avoid as much as possible multiple pregnancies. So we as a clinic have the duty of combining all these factors. So inform about all the genetic tests that are able and reachable to do by the couples, adapt the clinical strategy to each case, and maintain the good chances of having a baby. All the couples or single women or heterosexual couples have the right to have all the knowledge on their side before making a decision, because this is a very complex process, and of course that the point is that everyone wants to have a baby, and a healthy baby. At Ferticentro, we always recommend transferring only one embryo. Of course, there are certain situations when transferring two is advised. Of course, it has to be related with the quality of the embryos, with the financial conditions of the couple, because we need to see that this is also an important question. In Portugal, there's this private section in health, in IVF, and here at Ferticentro, of course, we are a private clinic, and we need to always take this in consideration, because couples need to make a huge investment in this kind of treatments. So this is something also that we need to take in mind when advising transferring one or two. But we need also to take in consideration the health of the women, their family support, always the remaining embryos that they have, the quality of the uterus when transferring the embryo. So this is all these aspects are to take in consideration when having the decision to transfer one or two. And all the team at Ferticentro is involved in the decision. It's not all about the doctors or the nurses, but of course the psychological department, the patient care department, the laboratory, the embryologist that has the knowledge to tell us if transferring that good embryo, the related with the quality, it's the best option or not. But of course, at the end, the final decision is always the couple or the women, because we need to respect their decision, but we also need to have our mind in mind that we gave all the information that we could, so they can do an informed decision. So yes, because at the end of the day, all we want the same, and we all want the same. That is having a baby at home, arms, a healthy baby, and we're here to help you. I hope that this information was good and was precise enough to help you, to give you an idea of what is possible to do before making that decision. Yeah, thank you very much for your time and for your attention. And yeah, I hope to see you next time. And Caroline?
Thank you so much indeed for explaining all those details, for a great presentation. I already have seen it before, so I knew it's going to be interesting, but thank you so much for that, for sure. And now it is time to have a look at the questions, right? So Q&A session is starting. So if you have any questions, go ahead, type those in, and Patricia will definitely try to help you as much as she can. And there are some questions ready. Let's have a look. Okay, the first question is right here. Will these live birth rates also be similar with increasing age?
Well, this depends always if there was, as I showed in one of the charts, it depends if the embryo was tested or not. because, as I showed, when transferring one tested embryo, no matter the age of the woman, the rates of live birth is pretty much the same. But if the embryos are not tested, the rates the rates of a woman transferring one embryo when having 42, it's very, very different if when having 35 years old. So that's the difference. So if the embryo is tested, the birth rates are pretty much the same. But if the embryo is not tested, that's a very huge difference.
Thank you so much for the very first question, and of course for your explanation to this. Okay, this is actually a very similar, I guess, question, right? So, but a single embryo could divide, right?
Yes, yes, it was shown in one of the first charts. There is when transferring one embryo, there is a very small percentage of there is a very small possibility of having twins. But of course, when transferring two, it's much higher. I don't know if it's possible to put the chart, the presentation again.
Yes, of course, no problem. Let me go here and just let me know which slide is this.
Is the first one, which I think is the second. Yes, here. Thank you. So as you can see here, the amount of twins here, it's about 2%. Okay, so it shows that when transferring one embryo, there's 2% of chance of having twins. So, and of course, when transferring here two embryos, there's a chance of having even triplets. So there's always a small chance of that an embryo divides. And we at Ferticentro have cases that happened. Of course, has it happened in nature? We all know cases of women that had twin pregnancy without doing any kind of IVF treatment. So this happens in nature. It can happen always also if transferring only one single embryo. So yes, that can happen.
And thank you again for explaining other question. And actually, as I've mentioned, another question is quite, I mean, it's the same as, can I have multiple pregnancies after a single embryo transfer? For the yes.
The small chance, but that can happen.
All right, thank you for the clarification. It seems that this is a topic that is very interesting for the patients. Okay, let's have a look at the next question. I understand you never recommend implanting two embryos. What cases would it be recommended, though? Are there any exceptions?
I didn't say that I never recommend transferring two, even though it's not me who recommend transferring two. We have at Ferticentro, we have a policy that we try as much as possible to transfer only one embryo. But of course, when there are cases, for example, women that didn't get the chance to do the genetic testing and that the embryos are not top quality, of course, here we need to see what are the best options. So here, in this kind of situations, we may advise to transfer two. But of course, this decision needs to be made with the knowledge of the doctor, knowing the health conditions of the women, the knowledge of the biologist and the embryologist to know if those embryos they recommend transferring two because of the quality of them, and also the support and the family and the personal reasons from the couple or the female herself. But of course, we have situations where we can recommend two embryos, but most of the time. And even though when we are talking about genetic tested embryos, we always recommend one embryo.
Excellent. Thank you again for explaining this as well. And actually, there will be another question. Can PGTA testing damage the embryo, and what are the additional costs of PGTA testing?
So the PGTA doesn't damage the embryo, okay? It's the technique that is, well, I cannot tell you, but with the very, very precise techniques that are removed a small part of the embryo, very, very small, that it's enough to send to the lab and to get tested. So far, we didn't have cases of damaging the embryos, and that those embryos, even if they were normal, that then would not be able to be transferred because of the biopsy. So that didn't happen, even though not everyone at Ferticentro, not all the embryologists are able to do this biopsy, this testing. They need to have certification. They need to do studies to be able to do these kind of techniques. The costs, well, this has to be discussed with the clinic or where you do the treatment, because then we don't do the test is not done here. I mean, the biopsy is done at Ferticentro, but then we send the biopsy to another lab in genomics, and I mean, they charge us, and of course we need to charge the couple. The costs are always depending on the number of the embryos that are testing. So this is the question that it has much to do with the country where you're doing, and also the clinic.
Excellent. Thank you again. And of course, as you can see, there is a thank you for you.
Thank you. Thank you,
Okay,
Martin.
excellent. And let's have a look. Next question is up. What advice would you recommend to have a good lining of the womb?
Well, we have, there are several kind of protocols that we do. There's always the medical point here. We need to see if there are any medical conditions associated that can interfere with the lining. Some women has some kind of some problems related with the fibromes, some cysts, some other issues that sometimes make it more difficult to have a good lining. But usually the majority of the protocols that we do that are based doing estrogens, there are usually with a good results. What advice? It's not, I don't know if you're talking about medication or some other aspect. What we recommend is that just we need to have a good knowledge of the uterus before starting the preparation. We need to know. It's very important to know if the cycles are regular, because this can interfere. Sometimes we have cases when doing already the preparation with the women that has a very irregular cycles that start bleeding during the medical treatment. So this is, but there's also things that we can't control, that we can manage. And sometimes we need to start all over again. So this is very specific to each case. I'm sorry if I didn't answer your question probably as you liked.
Thank you so much still for helping out, of course. Okay. And if you have any follow-ups, you know what to do. Just type this in. But I think it was still clear. There are some things that we just need to have more information on, right? So it's definitely. And actually, there is this answer from the patient for you. Thank you. That was good.
Thank you, Patricia.
Thank you, indeed. And do you often do hysteroscopy before the transfer? Does it raise the success rates?
No, we don't. We just advise hysteroscopy when there's case, when we have the, after doing ultrasounds, that are cases of some internal polyps that can interfere with the growth of the endometrium. So if the woman has usual regular cycles with no bleeding between cycles, between her period, we don't recommend the hysteroscopy just because of it, because doesn't rate the success of an IVF treatment. Okay, so we just recommend really if there's any case, any knowledge of internal polyp that is interfering with the endometrium growth. And in this case, yes, we can recommend it, but it's not on a regular basis.
Thank you for yet another answer, and very common question that I'm sure you receive very, very often: to transfer day 3 or day 5 embryo.
That always depends on the quality of the embryos and also the type of treatment that we're doing. Usually we do a D5 embryo, but of course that depends on the amount of embryos that are available to transfer. Because imagine that doing an IVF with your own eggs, that's unfortunately you only have 3 eggs available, for example. We will not go ahead with the D5 embryo because there may be no embryo available to transfer. So if we have a good embryo to transfer on day 3, we will do it on this day. This decision of doing on D3 or D5 always depends on the quality of the sperm and also the number of eggs available. So this is a decision that usually it's made on the day of the egg retrieval after having information about how many eggs we have available to do the fecundation. So this question of having a better result on D3 or D5, if an embryo is good on D3, on day 3, so the chances of having a pregnancy is as much as doing on D5. The difference is that on day 5, we have more information about the embryo, okay? And we have 2 embryos on D5, we have more information about them, and maybe we can see some differences between them. But on day 3, probably they look pretty much the same. And so the difference is because on day 5 they give us more information about it. But if an embryo looks good and with good conditions and has developed it perfectly on day 3, has much chance of having an implantation and a pregnancy as on day 5.
Thank you again for another interesting question, and of course your thorough explanation to this. And for now, there was like one more question, and we will be finishing slowly. So if you have any left, this is the final call for those questions. Go ahead, type those in. Don't hesitate, and let's have a look. This is the question from Kate. What is the benefit of a mock cycle?
Well, at Ferticentro, we've been doing this more and more because this helps us to test the womb to the medication. Sometimes it happens that we plan the endometrial preparation in a way, and that it doesn't result. It doesn't have a good outcome. The endometrium doesn't grow. So sometimes when couples and when the women have time and availability to do it, we advise to do a mock cycle. So basically, it's just mocking the same preparation as we would do for the embryo transfer. And if on the day of the ultrasound before the embryo transfer, the endometrium is good, so we confirm that that is the protocol to be used for the embryo transfer. So that is our benefit. Basically, sometimes we advise it more when women have more difficulty to have the endometrium in good conditions. For example, women that have done chemotherapy, that are very difficult cases to have their endometrium growth because they don't. The endometrium doesn't grow as it should, and usually they don't have the period anymore. For example, people that don't have ovaries anymore, that the endometrium is not renewing. Some specific cases we do a mock cycle because also we have a lot of patients coming from abroad, so we don't want them to do a preparation without knowing that it's going to be it's going to have a good outcome. So we just want to make them come to Ferticentro after knowing that the protocol it's the right one. Usually, the majority of the cases we don't do it because, well, it's there are no health conditions that can tell us that the endometrium will be difficult to grow. But when we have already some background, some history, some known history that specific case had the treatments, IVF treatments over and over again, and the endometrium was not good enough. So in that cases, we suggest always a mock cycle.
Okay, again, thorough answer as well. So thank you so much indeed. And one more question is right here. In your opinion, does the difference in type of transfer catheter used influence pregnancy success?
No, I don't think so. In Ferticentro, we use usually 3 types of catheters. In our well, this is the decision and the type of the catheter is really just because of the uterus itself. The internal, the cervix in some women can be very difficult to go through, and sometimes it's needed a more flexible or less flexible catheter. So that's why we make that we make the decision on the type of catheter that we use, but that doesn't have an influence on the pregnancy success.
Wonderful, thank you so much. And of course, there's a thank you. And it looks like that might have been our final question, but of course, remember that if you have any questions left, you can always get in touch with Patricia, her team at Ferticentro, and I'm more than sure they will be happy to answer and help you out. And it looks like that we will be finishing for tonight. So everyone, thank you so much for joining, for your great questions as always, and of course, Patricia, for your time again, and also for answering anything else you would like to add before we finish.
No, just thank you for the invitation. Thank you for all people that were present. I'm sorry for my, I was a bit nervous because it's the first time that I'm doing this. So if something wasn't clear enough, and if you want to have some more specific information, as Caroline said, you can get in touch with us at Ferticentro, and we'll be very happy to answer you. Thank you, Vania.
Thank you so much indeed. And you did great, that's for sure. So I just, I will be looking forward to our next webinar with you. So thank you so much indeed for that. And everyone, again, as you know, we will be finishing. However, if you have time and would like to learn some more, or just simply join us tonight at 8 p.m. UK time, go ahead, sign up. We will talk about infertility loss. So this is a topic that also is also very, very important. And if you wish, you can go ahead and join. Mandy Rodriguez, a clinical psychologist, will be with us at 8 p.m. UK time. So go ahead and sign up. And it has been recorded, of course, remember. And if we would like to get a look at the video once again, it will be available on our YouTube channel, but also on our website. As you know, over 300 webinars are available on myivfnurse.com already. So thank you so much, everyone. Have a lovely evening. Patricia, again, it's been great to have you here. Thank you so much. Have a relaxing evening, and well, till our next event then, okay, Patricia?
Thank you.
Thank you indeed.
Bye.
Bye.